Welcome to Hamlin Place. I'm Joe Cagno. I'm the administrator of this fine facility. I've been involved in long-term care for over 34 years in various capacities.
Hi, my name is Jessica Adams. I'm from Silver Census. How long have you been in Hamlin Place?
I've been in Hamlin Place for 3.5 years. Our goal here is to develop a facility that not only provides excellent clinical care, but does so in a home-like environment. If you notice as you enter my office, I don't have a lot of degrees hung on the wall. What I do have are my golf paraphernalia, my monkeys, which have an interesting story unto themselves. It tells people a little bit about us and creates a home-like environment rather than a clinical, institutional type look. We have several doctors that come to our facility. We have 3 primary internists, but we also have specialists that deal in pulmonology, cardiology, podiatry, physiatry, which is a specialty in rehab services, wound care specialists.
How close is Hamlin Place to the major hospitals throughout Palm Beach?
We are located conveniently equidistant between both JFK Hospital and Bethesda Hospital.
Do you work with area hospices?
Yes, we do. As a matter of fact, we work for all 3. We have contracts with all 3 of the local hospices, Vitas, Palm Beach County, and Hospice by the Sea.
What type of insurance do you take?
We take primarily all kinds of private insurances. We also take Humana, and of course, we do the most of our work with Medicare and Medicaid.
How often do you do therapy?
We have therapy available 7 days a week. We normally complete our therapy program in 6 days. We certainly believe in the philosophy of a day of rest.
How about food? Do you have a dietitian to monitor nutritional needs?
Yes, we do. We have a registered dietitian consultant who prepares all of our menus, both clinical and personal. We then have that dietitian is supported by our food service department under the auspices of a Frankie Johnson who has over 20 years experience in this particular field. And you'll be hearing from these charming people later on.
If my mom was to be a resident in your place, could I take her out to lunch and take her out to outings if I feel like it?
Absolutely. The only thing that limits your ability to take mom any place is a product of her physical ability to do it. We encourage families to take their residents home, particularly for holidays, special events, birthdays, and just to get out of the facility. It's healthful. Again, we are focusing on this is your home.
Do you offer private rooms? How does that work?
We have a limited number of private rooms should you desire, but most of our rooms are semi-private.
And you have a speech therapist or occupational therapist besides physical therapists?
Yes, we do. We have a full array of therapy from physical, occupational, speech, and respiratory therapy. We are also embarking on a new program in VitalStim Therapy, which is designed to increase your ability to swallow.
Now, what kind of diagnoses do you generally help? Stroke patients, diabetics?
We handle virtually all clinically complex residents, to include heart, lung, CPAP, BiPAP, trach, all types of orthopedic, hip, knees, shoulders, legs, just about whatever you can think of, we can deal with the complex care, IVs, etc. On behalf of myself and the entire staff of Hamlin Place, we look forward to serving you and your loved ones' needs.